Focus onto this now. So alarm has been raised over uncontrolled use of Ivermectin by the public. The South African Health Products Regulatory Authority last month approved controlled use of the drug to treat COVID-19. However, black market use has been discussed during a public webinar hosted by the University of KwaZulu-Natal. We speak now to UKZN Professor Colleen Aldous, who was part of that webinar. Thank you very much, Professor Aldous, for joining us this afternoon. So let's start with the assertion that the debate on ivermectin has damaged the relationship between science and society, you believe. How so?
I think there have been many scientists who have been dismissive of ivermectin. And the internet has got research that is coming through that even the lay public can access. So the public have been able to read for themselves, and they're taking things into their own hands. And so the dismissiveness of much of this that's come from senior scientists has, I think, damaged the relationship between science and society. And I think science has a responsibility now to win back that trust through looking at the evidence a little bit differently.
Is it as easy as that I can walk into a facility and ask for ivermectin and I can administer it myself? Or is it a little bit more complicated than that?
No, it's a Schedule 3 drug. It's registered on the South African law as Schedule 3, which means you have to get it from a healthcare worker, which we support. Anything that is antiparasitic or antibiotic should be administered with a healthcare provider knowing what's going on there. So currently, under the Controlled Compassionate Access Program, the drug is only available at certain places who are able to stock the legal ivermectin that is being imported into the country at the moment. So nobody can just walk into a pharmacy and buy it over the counter.
You mentioned a little bit earlier on how scientists are divided themselves on this, which now also informs public opinion. Is it necessary that you sing from the same hymn book? I mean, SAPRA is comprised of some of our finest scientists and medicine regulatory policy experts. Should we not put our trust in that and maybe allow for people to hold different opinions?
Absolutely. Public debate is very important. The problem I have is that so many senior scientists are just dismissive of the research that has already become available from across the globe. There are well over 30 studies that have been published already and on preprint. And if we remember, it was the WHO who requested preprint information in 2015 because of the Ebola health crisis that we had. The WHO had said that we cannot withhold any data that could potentially help in a health crisis. So the senior scientists are dismissing much of the science because it's in preprint format. I believe that we should have a new way of looking at things, not insisting only upon double-blinded, randomized, controlled placebo trials. That the evidence that has come through, because there's so much of it, deserves another way of applying our wisdom as scientists to look at possibly making a decision with more than just double-blind randomized control studies. And very exciting this week on Thursday, to a South African audience, Professor Eli Schwartz from Sheba Hospital in Israel announced that his double-blinded randomized control study that used placebo showed a definite impact with ivermectin, that there was definitely a faster clearance of the viral load. So yes, double-blinded, randomized, placebo-controlled studies are very important, but they take a long time and cost a lot of money to complete, and results become available. But there were other results available in November, December, and January that people were neglecting because they said they weren't from the standard of science that they would respect, or from the countries where science would come from that they would respect.
You mentioned that some scientists were dismissing the use of ivermectin because of its preprint format. What does that mean? And also when you speak of double-blinded placebo-controlled studies, what are those?
Okay, they talk about the double-blinded placebo-controlled study. That is the gold standard for a drug. That is, if you're developing a new drug, you would put them through double-blinded, which means the research participant doesn't know what they're getting, whether it's a placebo or the real drug, and neither does the researcher. Randomized control means that some people get placebo, others don't, and it's random. Nobody would know, there's no way that there can be any bias. So it's the top level of drug research that is available. But if we have a look at the context, last year, people did not think about double-blinded randomized control studies for everything that they could. They were just looking at what drugs worked in this pandemic. So that's double. I can't remember your first question.
Oh, preprint format. You mentioned that some scientists...
Preprint format, yeah. That is, if a study is complete and the scientists have prepared their manuscript for publication, they can put it on a preprint website so that people have access to it. It's not yet been submitted to a journal, or it's been submitted but not yet peer-reviewed. And the peer review of research has been very important for centuries to ensure that we have quality medical research happening.
Right, and just finally, perhaps you also discussed the black market in terms of Ivermectin. What is it that you found there?
Well, there are drugs that are available in the black market that contain no Ivermectin. There are scoundrels who've gone out there who've created possibly placebo tablets and are selling them for exorbitant amounts because people are buying them as their last hope. In addition to that, this week, people did some research into looking at what those tablets could have contained, and there's a lot of contamination with other drugs. So the black market drugs that are available can be quite dangerous.
And how would you tell the real thing from a fake?
That's the problem. If you buy it from anybody who's not got a Section 21 approval from SAHPRA to have it, you cannot know if you've got the real thing or not. So the Section 21 approval has been given to several people. So within the next week, drugs will be arriving in this country, and doctors who apply for their patients to get it will have access to the drug that has been approved by SAHPRA to be imported.
And that's where we'll have to leave it. Thank you very much for your time this afternoon. UKZN School of Clinical Medicine Professor Colleen Aldous. On to